Once again, my name is Peter Rukanakami Simon. I'm from the Department of Physiotherapy, Marwadi University. For Orthopedics 2 topics which was assigned for me in orthopedics, in orthopedic or musculoskeletal physiotherapy. One is I'm going to talk on lumbar spondylosis. In lumbar spondylosis, we talk on degenerative changes which occur in a lumbar region. One, the lumbar region consists of L1, L4, L5, L4, L3, and up to L5, which can be lumbar region. Now, the stages, the places can be affected in the lumbar region. There are causes of which affect the lumbar region. One, caused by one, we can show the postural changes. The postural changes can even sometimes affect the lumbar region. Why? Because due to the lumbar spine positioning changing, which can affect like cracking and its affection of the lumbar. Then another one also we can talk on prolapse disc spondyle. Let me say PIPD, prolapse disc diseases. Prolapse disc due to the protrusions of the nucleus pulpus cells and another fibrosis in the lumbar region, which can also affect the lumbar spondylosis, which patients can manage. Then another one is the infection like osteomyelitis, and another one like infection like osteomyelitis, and infection like TB. This is the most sometimes affecting the lumbar spine. Then first of all, we are going to talk on the clinical findings of one, patient might feel pain at the lower back. Two, patient might unable like to turn backward. And two, three, patient unable like to flex the abdominal muscles. Let me say to do flexion and extension of the back due to the pain. Thirdly, patient might feel like postural changes. The posture of the patient might be changed. Secondly, patient feel stiffness. Then let me come. There's one special test which can be confirmed either the patient is suffering, patient is affected with the lumbar spondylosis. One is what they call straight legs test. Straight rising leg test. One, the person is the supine positions. Supine positions. One leg is straight, lifting to the splint, and another one is raising up. So for you to identify, patient might feel tightness or tingling numbness pain around the gluteus region, and then at around the hamstring muscles. So the hamstring muscle, you must identify that the sciatic nerve compressions of which occur between the L1, let me say between the L4 and L5 and L4, which might be affected. This can be positive test which can be found for the strength training. Another, you can use a SLAM test to identify any other muscles for the raising exercise and zoom. The range of motion might be affected. Due to range of motion measurements, you can find that there is a reduction in range of motion. Then there's investigation of lumbar spondylosis. In a lumbar spondylosis, investigation which can be done is X-ray. The X-ray which can be applied like to identify either there's an infection between the two, or there's one dislocation of the lumbar spine, or there's how the infection. One thing that will be identified, there will be reduction in the joint disc, the disc space. Two, the osteophyte formations might be present due to degenerative changes can occur. Three, joint space of fasciitis joints is affected. Then then you have subluxation of one to the other joint. Neither the investigation which can be done during the episode. Now we are going to talk on how we can manage this one, lumbar spondylosis. There are three things. Since there is the presence of all these disease which we find out in lumbar spondylosis in the lumbar spine, we are going to give some management. The one management what we are going to do, we are going to prove our goals. We are going to give the first goal is to let me say reduce like pain reduction, and another one is increase range of motions, and another one is to reduce tightness, and another one is tenderness which is occur around. So the modalities we are going to come to management. The first management is pain, and how we're going to manage the pain. The first pain we are going to apply is ultrasound. Ultrasound plays much important and everything. And another one we are going to put tense, but normally we are preferring shortwave diathermy. Because why? It is the deep heating modality. Whenever like we hit the space between joints or between the joints and maneuvering the place where the infection diseases which is occur, whereby the degeneration is in, but we are preventing when the degeneration occur. Then now another one, you can give also IF2 very well. It's very important. Then to come to exercise, you want to count flexibility of lumbar. You can give stretching and then other thing. But in stretching also is the most important thing in the lumbar region. Then another one, you can reduce the tightness of let me say sometimes whenever you find out there's a positive in a stretch leg test, you give stretching of hamstrings and stretching of the gluteus region. This can be helped in the relieving of any other pain. So I might stop here. Thank you very much for listening. For my point, we meet in the next lecture. Thank you.